Unfortunately, about 3,000 asthmatics or so die every year from complications of asthma, and there's a whole bunch of emergency room visits. Most asthma can be managed just by puffers or inhalers that patients can take, though sometimes folks fail those. They require constant doses of prednisone and a steroid to dampen their asthma. Some end up repeatedly in the emergency room, and it's really those patients that the studies have been utilized for and that seem to benefit from bronchial thermoplasty. Some patients, their quality of life is terrible. They wake up in the morning, they are taking their medication, and in between doses of medication they can be short of breath, not able to do sometimes their activities of daily living. Some people are not able to work. Some people can't go into any other environments because they're always triggering their asthma. So, for example, they'll go into someone else's home and have difficulty with their asthma. And the worst is, people who miss work all the time, who end up in the emergency room at night on weekends, who end up in the hospital. And then the very, very worst are people who end up in an intensive care unit, maybe even on a breathing machine or a ventilator with their asthma. These are the ones I think that would benefit mostly from bronchial thermoplasty. Bronchial thermoplasty, then, we go down into the airways. It's done in 3 separate treatments, one that does the right lower lung, one that does the left lower lung, and then one that does both upper lungs. And they're about 3 weeks apart, so the 3 treatments are 3 weeks apart. When we do these treatments, once we get down to the areas we want to treat, which are the breathing tubes, the distal breathing tubes, we put a catheter down and then put it out in the area that needs to be treated. And that catheter then, after we push a foot pedal, releases heat, so thermal heat that effectively does away with smooth muscle. And smooth muscle is what constricts the airways in asthma. So basically the procedure starts with the distal airways and works its way proximally, so from further to closer in. And we generally activate the machine about 40 to 60 times, depending on the person's size of their lung and how the procedure is going. And then the patient goes home and on the same day and then comes back 3 weeks later for another procedure. We've been unbelievably impressed with some of our severe asthmatics. What's the main thing they tell me is that they're just so much more stable on a day-to-day basis. They're not having these really bad lows where they have an acute exacerbation or acute worsening of their asthma. What we've seen with these people is that they've been able to go on less medication. They've required less visits to the emergency room. In fact, most of my patients haven't been back to the emergency room, which is a huge change, and less oral steroid doses. In fact, most of our patients right around the treatment time have not required oral steroids, which again, one of the problems with chronic use of oral steroids is weight gain, diabetes, trouble with your eyes, bone weakening, likelihood of getting more infections. Not that we don't use steroids, and there's a place for them, but if you could keep off the steroids, that would be great. So that's the kind of changes we've seen in our severe asthmatics. I went into doing this procedure a little bit skeptical. I wasn't sure it was going to work. I'm still not sure exactly how it works. I mean, there's the reported therapies, but one thing I can tell you, after we did a number of patients, I'm not a skeptic anymore. I think there is truly a place for this procedure, particularly in this subset of patients with severe asthma. I think that it can work and can work very well.